and providers. And also, I think there's an opportunity to create this connectivity where we can bring medical expertise from around the world to the bedside for both collaborative discussions, but also to help with patient care and other needs. So I started this journey many years ago, but really got very focused around the time of the pandemic in mid 2020, when I saw that there was significant consequence that we didn't really even anticipate, was that when medical students were being sent home during the height of the pandemic, there was creating this disparity of clinical experiences, meaning they weren't at the bedside, they weren't talking to patients like they normally would. And we saw that this decline in bedside teaching was really detrimental to their educational experience. And there was concern for what that would lead to in the future. Also, how are you able to teach while mitigating risk of exposure and use of equipment for protection? So we created initially at that time a mixed reality opportunity around telerounding, where we basically set up a system, and this was in partnership with, at the time, Microsoft, and using their HoloLens 2, but setting up a workstation where we could go around and rounds and bring on into the wards and into the bedside a whole team of students and residents while one person was rounding, and have that experience, being able to see the physical exam, being able to interact directly with the patient, even if you were sitting in your living room. So we thought that was something that was really helpful at that time. And what we learned from that was that we could really utilize this technology to really bring anyone from anywhere into the clinical environment more easily. So we started to partner with some other groups, and we actually said, well, could we bring anyone from around the world into the bedside to have meaningful discussions? And at the time when I was at University of Michigan, we created this opportunity with Imperial College of London, where we did the world's first mixed reality international grand rounds in late 2020. And this was a live event with polling from the audience, but also immersive patient presentations where we brought in expertise from both sides of the ocean to really weigh in on some complex cases. And we learned a lot of lessons from that, and also what barriers that needed to be overcome. So we did this again a few months later, and here you can see an example of a cardiologist in Michigan interacting directly with a cardiac surgeon in the United Kingdom, where they can bring a DICOM image of a cardiac anomaly into the the AR environment as a usable asset that they can both talk about and manipulate in real time right at the patient's bedside. So here you're able to now bring expertise from anywhere in the world right to the bedside, having a meaningful discussion for patient care. And we did this again, and showed that, this interaction can be incredibly impactful, but also how do you then bring specialty care to remote areas? And the thought is we have a lot of problems around the globe, both in the US and abroad, around access to care and access to specialty care. And could these technologies really break down those barriers and democratize healthcare in a way that we could bring expertise from the best surgeons and the best proceduralists or the best experts anywhere in the world to the bedside to help with patient care decisions? So a few months later, we decided that this partnership to solve these bigger problems in XR and healthcare cannot be done by any one institution alone, and that we need both industry, academia, and government agencies really working together to really break down some of these barriers and solve problems. So we created at the time, between the University of Michigan, University of Maryland, and Maryland Shock Trauma Health Center, the first NSF center for in extended reality in healthcare. And this was really meant to help democratize XR, to improve health, to create training and recruitment for the next generation of what we know is going to be a diverse XR workforce. But also, how do you bring together computer scientists, engineers, healthcare providers to really access a diverse patient population to expose them to advanced technologies through XR. And whether there's problems with scenario acquisition, latency, processing power, telemedicine and telepresence, human factors and usability, AI and predictive modeling, or imaging and displays, we thought all of these areas could be collaborative areas where industry, academia, and government agencies can come together. So this was a team effort between many people, Dean Varshney at University of Maryland, Professor Sarah Murthy at University of Maryland Shock Trauma, Professor Rishi Reddy at University of Michigan, and then I've been part of the group from the inception. And this is many industry partners coming together to really think about this effort. Microsoft, Sony being the two big players coming in right away. But I also want to highlight that this was a very important area that the FDA felt was an opportunity to be engaged with and to think about where these solutions are going to be applied and how can we create the responsible and appropriate ways to review these so that they get in early enough and thought through so that the patient experience and outcomes and risk is mitigated early. And we've added many other partners along the way. But the goal of this is to really advance XR through this collaborative effort. And each institution, each company that comes to the table brings its own expertise. Certainly at the University of Maryland, there's a lot of expertise around imaging and data capture. They have an amazing Holo suite where they can capture images from hundreds of cameras to create 3D assets that can be put into the XR environment. We had a fun example doing this while we were there for our first board meeting. But they're also studying very important issues like cyber sickness and how to mitigate that in XR environments. University of Maryland Shock Trauma also is looking at procedural applications of augmented reality, whether it's using it for ventricular drainage or intubation, or even for fasciotomies. And then University of Michigan certainly has a lot of assets that it brings to the table, many studies in this space, a large group of collaborators that really across disciplines that are really thinking about this from a programmatic training and a care delivery way. But when we think about, training and skills development, I think we have to also think about competency-based assessment. And in the future, I think this is really going to be a key area of development for XR, not just to think about simulation training for medical students, but also how do we make sure that procedures are done with a certain level of competency, and how can we monitor that or maintain that remotely proctored, or allow that to be kind of new standards of defining skill levels. So we've done several scenarios where we look at different types of procedures, and this can all be done in XR. But then imagine if you were doing those procedures and you had AI and some way of monitoring that and comparing how you do versus how an expert would do this, and having the ability to remote proctor that as well. So we've partnered with several companies, and I think one of the key things is trying to see what's the best technologies out there, what are the real opportunities, and thinking about, how do you advance these technologies into the healthcare space to really improve training, to really improve patient outcomes. And we've had some great collaborations with different groups thinking about how markerless registration, how to use these technologies in procedural setting, how to think about, where the imaging and the planning for surgical procedures, or the application even in the future in the operating room during procedures, how do we utilize these technologies most effectively? And we can think about AI and machine learning as part of this. So being able to capture these data images and do high-level rendering and registration, you can imagine that we can create computer algorithms that can define certain anatomical areas and also define where there may be opportunities for 3D printing grafts for vascular procedures, or thinking about a surgical approach more easily that can help with time in the operating room, as well as avoiding structures you want to avoid. VR is another great tool in this space for being able to train people in different procedural skill sets and steps. One of the challenges that's being worked through is how do you incorporate haptics into that so you get feedback of what your hands and your body is doing in these environments. But I think there's also a lot of benefit just to being able to practice all the steps in a particular procedure and creating that mental and muscle memory that's so key to helping you be more efficient and avoid errors in the future. We also think about how do we train not just our medical personnel and workforce, but how do we train people at large about certain life-saving procedures? And we're thinking about, are there opportunities in VR where you can even teach things like CPR and cardiac resuscitation, and some things that a layperson could benefit from as you would think about where this aligns with just teaching some basic skills to a broader workforce. So at the University of Illinois, we have a great group of investigators from many different areas in engineering, in the business school, and medical school, and allied health professions across the campus, really learning about how do we bring together XR technologies in the healthcare space. We have several sim centers on the campus and our health system partner. And our College of Medicine is uniquely set up to kind of look at some of these questions in a way that takes a slightly different approach to medical education. As the world's first engineering-based medical school, we really focus on how do we integrate human-centered design thinking, how do we integrate engineering design into medical curriculum so that students get exposed to, and not only that, learn how to be that bridge between industry, academia, engineering. And many of our students participate in XR-related scenarios, both development, but also creating new scenarios and use cases in the clinic. And so we have a broad program in this. Another area is our Immerse Center, which really is brought together several groups on the campus around programming systems, thinking about how do we create distributed networks? How do we incorporate AI and haptics into this? And how do we solve some of the problems around computing and processing power that have been some limitations and barriers in the XR space? But these applications are in healthcare, they're in engineering, and many other fields. And how do we create human-centered models that really transform the classroom and the hospital of the future to where we can use these technologies in a variety of settings? And there's several areas that the Immerse Lab works on. There's groups that are working on hardware and software systems. There's groups working on next generation wireless systems for use with XR. And then also our National Supercomputing Center for Applications has a visualization lab that's really looking at how to turn raw data into visual displays that really interact with the patient and really help unfold this kind of human XR experience. We have a great imaging group that's focused on MRI and MR acquisition, and how do we take markerless registration and be able to create imaging that can be overlaid onto patients in the operating room or used as a teaching tool to plan for surgical procedures. And then we certainly have our JUMP simulation group, which is heavily involved in healthcare simulations, both for training of education of students, nurses, physicians. We also work on soft skill training, team training, and creating protocols for the clinic that can help with compliance and improving outcomes. So there's a lot of work being done there, and that's in partnership with JUMP Arches, which is in Peoria here in Illinois. And we think that these type of programs can be very impactful. As you can see, I'm going to highlight just a few of the examples we've been working on. We cover a large spectrum of XR applications in the healthcare setting, whether you're looking at training of soft skills and thinking about social determinants and thinking about how to avoid unconscious bias in the healthcare setting, to things like surgical planning with VR, looking at tumor resections, to how do we incorporate robotics in the healthcare space, to other things like segmentation and registration of complex images in the procedural suite. So one area that I think is really interesting way to apply XR is how do we train providers more effectively when we think about cultural competency training and avoiding unconscious or implicit biases. I think XR can create a variety of different scenarios that create awareness as well as education in the simulation space. We can think about opportunities for AR, whether it's using headsets or even using your phone as an AR device, to look at things like skin lesions and other things that can be both educational and help with diagnosis. But training a workforce with XR is, I think, a very important application. And, when you think about in the nursing space, there's a lot that goes into responding to acute events in the hospital, where often you have to bring in the procedural cart, or what we call a crash cart. But a lot of times what's in there is not very well understood by what drugs are in which drawers and how do you get to them most quickly. And once you open it, there's a big expense to not using it. So being able to train and have very specific efforts in this has really helped with some of our nursing protocols in our health system to be more efficient with use of resources. I mentioned surgical planning. We have a great collaboration with Professor Matt Bramlett and his team at OSF Healthcare, but looking at how to do 3D representations of complex anatomy for surgical planning. And he's now worked with clinicians to do over 400 cases that have been implemented in the real clinical setting. We also think about education in this space to create, use VR as a way to do simulated patients, as well as thinking about how this learning tool can be more effective and immersive than a simple lecture. And so as we incorporate these type of tools into the medical education, we really see an opportunity it can expand to how we think about training students in all aspects of their curriculum. Robotics is an area that's growing in the clinic, and the pandemic certainly enhanced some of those efforts. But how do we think about applying some of the XR technologies in telerobotics and telenursing?
Here I have it where
So here, there's another example of this, and I'll turn the sound down here for a second.
Everything is very colorful.
Just
and instead of having the entire CSF, I just pulled the ventricles out as.
Sorry. So what you can see here are some different fully automated segmentations that have been applied to clinical imaging, whether that's cardiac, neuro, but they're very high quality images where you can really manipulate them in 3 dimensions, really look at anatomy and at a level where surgical planning and procedural planning can be very high level. And we think that these type of scenarios can be very helpful to clinicians as they approach complex cases and plan ahead in a way that optimizes outcomes in the operating room. So I mentioned our unique medical school, and that this is really an opportunity to transform medical education, and certainly XR and the applications of simulation are a big part of our training. But we really also try to think about how do we take engineering and innovation and utilize that throughout all phases of a medical school curriculum. And whether that's in problem-based learning scenarios to think about human-centered design thinking, to engineering rounds in the clinic where we look at how to solve problems from a patient or a physician's perspective, whether that's an XR application, a new device, or even a process innovation. How do we apply those things where medical students are really leading those efforts and thinking about solutions that can then be implemented in the clinic? So when they graduate, they have a very unique skill set that's very highly sought after because they understand how to build teams to solve these complex problems in healthcare. And they're already starting to solve and break down some of the barriers on the XR space. We've partnered with some of the leading companies in the field to think about how to advance medical education using XR. And I'm going to show you a couple of examples of some of that we've been working on here. So with one of our partners, which is GigXR, we've really thought about how do we advance medical education around simulation and standardized patients. So imagine if you could create a scenario where from any environment, you could bring in a holographic patient that can be altered to fit whatever area you want, whether it can be, a young male or an older female, it can be an obese patient, it can be a child. You can bring in all these different scenarios. You can bring in natural language processing where they can talk to you in different dialects and different languages. And you can bring in every tool you have in your clinical environment right to the bedside, whether it's diagnostic equipment, whether it's imaging, ultrasound, et cetera, and be able to use that to both interact with the patient and make the diagnosis, but then also think about the treatment and procedures that would need to happen to help that patient. So the whole spectrum of what we do with high fidelity mannequins that cost a lot of money to maintain and upgrade, we can build into these scenarios so that people in low resource environments or people that are remote can participate fully in these immersive opportunities. We also think that team training is very important in this. And here's a scenario we developed recently at the college, but here you have several students in a room, and now you have a patient having an asthma exacerbation.
While we're waiting, can we get a history on this patient?
And so you can hear her wheezing, you can see her retracted breathing. It's a very immersive experience for the students, and they have to work together to really define the problem. They have to evaluate her, ask her questions, and then start doing things to help make the diagnosis and treat the acute problem. And if they don't do it in the right time, the patient continues to deteriorate in front of them. So it really creates a very realistic environment similar to what they would see in the emergency room. But they have to work together as a team. They have to collaborate. And we feel that this type of immersive scenario is going to be part of the future of medical education and residency training as well. And as we think about all these different tools that we bring into our XR environments, we can really transform how we train our students and our residents in a way that lets them really see these scenarios before they interact with patients in the clinical setting, so that they have a lot of these skills really ingrained in them and they become much more competent and efficient in those processes. You can proctor these sessions remotely. You can bring in experts from other disciplines, other locations, and all of this is to be helpful in the student's education. You can even incorporate some high-level anatomy and physiology to explain what's happening at each step of the process, so that as students make maneuvers, they can really see what's happening to the patient in real time and physiologically. So we feel these type of interfaces are incredibly powerful and really going to transform the field in the future. So the last thing I want to touch on in this talk is, where is mixed reality heading in medicine, and what are some of the challenges we face? So I think there's some barriers that still exist, and they're real barriers that are being worked on right now, but that includes things like, how do we protect data and store it in a way that's both HIPAA compliant and avoids data breaches or data risk, especially as we start putting these headsets and systems in wireless environments. how do we fix the problem of latency? We've gotten a lot better with it. I think there's, for a lot of applications, there's almost instantaneous effect. But when you're trying to utilize high data storage type of complex imaging, and you're trying to manipulate that or change it in real time, there's still got processing and latency issue that we're trying to work through as the computing starts to get better. How are the ergonomics and human factors? If you talk to a lot of clinicians, especially surgeons who have used some of these AR and headsets in the clinical environment, they'll tell you that the user interface is not plug and play. There is a learning curve. There are some challenges with it, and it can be at times a little bit of a distraction as you're trying to do things in the clinic. There's still a cost issue. A lot of these headsets have a price tag, and health systems, especially if you're wanting to invest in dozens or hundreds of these, it's not a trivial cost. And then when we think about, issues with some of the VR training, is how do you get force feedback haptics that are really meaningful to the user as they're learning procedures, as they're learning things. There's still some of these barriers, but I think a lot of the industry and certainly academia is really focused on what can we do together to break down these barriers. And how do we get adoption? I think the adoption and scalability issue is a real thing. There are champions for these at different universities and at different venues around the world, but to really get larger scale adoption and generalized use, I think some of these barriers are going to need to be lifted in a way that really allows these technologies to be easier to use in the clinic, to really demonstrate that competency and efficiency model, and really drive adoption. And I think there are niches for AR as well as for VR. I think the overlay of mixed reality holograms into a real environment can be very helpful during procedures, during clinical interactions. I think for simulation and education and practicing things, VR has still a very important role, and there's a lot of content there, and companies that are working on adding more content day after day. So I think both areas are growing, and I think that each will have its own niche within the healthcare system. Some of the companies have really moved things forward to where they've gotten 510(k) clearance for the use of AR products in healthcare. Probably the first was Medivis, which has a surgical imaging platform for surgical planning. MediView came on most recently with their clearance of their visualization and navigation system. And certainly Apocular had clearance for their surgical planning platform last December. So as more companies are starting to get integrated in the clinical space, breaking down these barriers, learning about how to improve and drive adoption and scalability are certainly going to be important. And this is where I also think that getting more validation from larger groups will certainly help with some of that adoption. We think about opportunities to engage. So government contracts, working with different groups such as the military. There's one of our XR companies out of Illinois, Induvo, has been very much focused in this space and has been very successful with many different government contracts to move XR products to train medics, pilots, et cetera. I think our public-private partnerships and centers are a great way for this type of work to happen. So whether it's through the National Science Foundation, through university-driven public-private partnerships, et cetera. Together, we can do a lot more than one individual institution or one individual company. And I think we also learn from each other what are these barriers that we're trying to solve, because it does take both sides of that fence to really start to really pull down these barriers. And engaging health systems in this process is really key as well, because the data-driven effects of where we can go with this, both for outcomes and for educational competency, accessibility is really going to help with the adoption and scalability. And as we think about that, bringing in accreditation bodies like the American Medical Association, the American College of Surgeons, the AAMC from a training perspective, American Red Cross and others, like how do we use these organizations to help with granting competencies, granting privileges, helping with training and et cetera. So as we engage and think about where this space is heading in the future, it'll be really important to bring in these agencies as part of the conversation, because I think if they agree that these technologies with XR in this space are useful and should be the new gold standard, then how do we, that'll also drive wider scale adoption and scalability. Certainly, as we think about this, we have to address the issue of ergonomics and user interface. When you look at all these headsets, and here's just a few examples I show you here, we still haven't gotten that form factor to where people feel like it's just easy to use and plug and play. So if we could create systems that were truly plug and play in healthcare that interface seamlessly with the electronic medical record and are lower cost, I think you would see a wider spread usage and adoption for sure. And we still are working on how do we improve processing, how do we enhance that instantaneousness of effect. So when you do something in the environment, is there a delay? Is there still a lag? If you're connecting with someone 3,000 miles away, how much of a lag is there? So these are kind of issues that are currently many groups are working on. But only together are we going to be able to solve this. So I think this is worth further work. So my last slide is just what I think is important take-home points. This is certainly a growing industry in healthcare, and it's here to stay. This is not just a blip in the screen. I think the number of folks that are focused in this area, both from an R&D perspective, but also from an innovation and commercialization perspective, is only going to grow in the next several years. And how we apply these unique AR and VR technologies to help with training, procedures, telemedicine, clinical care delivery, I think there are niche areas for each of these, and I think the applications are only going to grow. I do want to recognize that barriers still exist in the industry to adoption and scalability. And as we work through these barriers between universities, companies, government agencies, we should be able to improve that user interface, that latency issue, the EMR integration, and the data protection and integrity. And so I think that plus buy-in from accreditation bodies will really help overcome these barriers in the future. But this is an exciting field. It's a field I've found to be incredibly rewarding to be a part of. And I look forward to any questions and comments from the group. Thank you so much for your time today.
Great. Thank you so much, Dr. Cohen. Would like to remind you all that we have a Q&A chat, so feel free to enter your questions there. But I'd love to just draw on your experience, Dr. Cohen, because obviously you've been able to scale mixed reality across now 2 organizations, which, I mean, from my experience, which is much more brief than yours, is wildly challenging. So I'm curious how, from your perspective, how have individuals that are trying to really gain and develop like an XR curriculum, how are they able to really best get buy-in from the key stakeholders that really are the gatekeepers for adoption?
Yeah, so I think when you think about, creating opportunities in an organization, you really want to identify who are the people that are going to be champions in different disciplines, and who are the people that are working in this, in other areas that we can bring together. Because to really create value in an organization, you need to show that it affects multiple stakeholders and users and disciplines. And the more of that you can bring together in collaborative efforts, the more voice you have with organizational leadership to kind of create some infrastructure and opportunities to expand that. And so that value proposition really has to be built on creating these collaborative groups of stakeholders that really all feel that this is an opportunity, and demonstrating and going after kind of the early wins and the things that are validate and pilot and show that it's making a difference in certain areas, and that will drive additional scalability and adoption. So I think there's lots of opportunities there. It's not something you can just put a stake in the ground as a single person and expect to get resources and build a whole center out of this. But it's certainly as you learn the landscape and who's doing what at your institution, how do you bring in that group together to really drive a broader effort?
Definitely. And to that point, implementing XR can be pricey, especially initially. So curious also from your experience, where have you seen ways that institutions can really show the ROI and those values that you're kind of mentioning throughout of like XR when pitching it to their key decision makers?
Yeah, so I think that one of the things that especially academic medical centers and health systems look at is what's the financial ROI, but I think you also have to define what's the educational ROI and what's the training and outcomes based ROI. And if you can show that there's in these different domains that you're pushing the needle in the right direction with these technologies. And that's why I think it's important to start early with pilot studies that show a benefit, that show user experiences improve, that shows that you can create more efficiencies in the system, or you can lower some other costs that the health systems currently encumbered with through using these technologies as a way to improve some of the outcomes and efficiencies. Then you can really create an ROI proposition for them to invest more in it. And I think that the other thing to think about is what's driving the future state and where is a competitive advantage and opportunity. I think in education, I think in telemedicine and clinical care delivery, as institutions think about where they want to advance different directives, you can align XR with that in a way that's very helpful.
Would like to field some questions from the audience. I see Ryan Beams recently asked, for building a community to address the big challenges, do you see the starting point as creating the general framework, or starting with like specific application spaces, such as training and building out from there?
Yeah, that's a great question. I think you have to do both in parallel. I think you have to start building the framework, but then also running some pilot cases and use cases to really demonstrate the benefit, so that it adds on to that framework and allows for expansion of that framework. I think you need some basic resources to help drive some of those pilots too. So that helps you kind of establish that framework. And again, every institution is going to look a little differently, and what that infrastructure is, what its resource capabilities are. So you have to keep that in mind as you're starting to build these. And if your institution doesn't have a lot of resources, then it's a great opportunity to partner with another institution where you can add value with additional trainees that can be added to pilot studies, and you can kind of run things that way and collaborate. So I think there's a real opportunity here for people to come together who are interested in this space.
Alan asks, how has AI been implemented and integrated into existing XR and AR programs? And do you see this being the next step, and what are the challenges here?
Yeah. So AI is being used in several of these. So for example, one of the scenarios I showed was central line placement, and there's different steps going into that procedural process. And so there's an AI algorithm that goes into that defines if the user is following the sequence of steps, and if not, it lets them know where they've gone off the track in terms of their procedural sequence, but also if it analyzes their motions compared to expert motions and tells you how accurate you are, or with your angle of your needle, or with your motion of your hands, etc. So there's AI applications like that. There's other AI applications around imaging, where you could take registration of imaging sequences and then use AI to identify dimensions. For example, like if you had an aortic dissection or something, that you could take a CT angiogram and look at the whole aorta, but then use AI to identify what's the distance of the dissection branches, where are the branch vessels, and then use that to create a 3D printed graft that can then be put in the patient to fix their dissection. So, I mean, there's a lot of applications of AI. On the educational side, it's around competency assessments. Around the imaging and registration side, it's how does it adapt to different areas of where a tumor is, where you would want to think about a surgical planning. And even to the extent of how do you think about motion artifact with a patient. So if you overlay a registration image on a patient and they're breathing, how does that image change with breathing? And the AI can be used to think about how to adapt the imaging to respirations, et cetera. So I think there's a lot more in the future where AI is going to be helpful, especially in the processing and how we think about taking the imaging and the digital environment and incorporating it into the real world scenarios.
Brian asks, his question is regarding the establishment of standards, particularly concerning human-centric design, which I know you brought up within your talk. Curious about whether connections are being made between Europe and the US, or how the US is really contributing to discussions of standards in this process.
Yeah, I appreciate the question, Brian. So the answer is that we really need to, and this is where these public-private government partnerships can be very helpful. There's a Whole of Medicine Association that's a global association that's thinking about creating some standards and some white papers around this space. And then also there's some new groups putting work together on a global stage. So, for example, our College of Medicine just initiated a new global consortium of innovation and engineering in medicine that has about 15 different countries involved. And we're thinking about how do we think about applications of AI and XR in the clinical environment, along with other types of education and skills development programs. So I think you're absolutely spot on that this needs to be a multi-international effort to think about how do we create competency-based standards, how do we create opportunities for both applications, but also making sure that people are following what's considered guidelines of what's the right way to avoid things like data breach and other things. So I think this is another area where the FDA has been actively involved in some of our collaboratives to think about what are some of the standards that need to be thought about. And so I agree with you. It's an international effort, and we certainly are getting engaged in this, both in Europe, the UK, but also in Asia.
Great. And we have a few questions related to partnerships and collaborations. I know you referenced quite a bit in your talk, but I think the main takeaway question here is, how do you really make the decision of what to adopt, and what are some criteria to your selection process?
Okay, so that's a great question. So we try to go into this with a bit of an agnostic view, where we really want to make sure that we're bringing the best technologies forward. So when we evaluate a technology and think about use cases, we recognize that this may be great for now, but the future, it may be something different that's even better. And so as we try to move forward with each step, we try to see what's aligned with a problem we're trying to solve, and where's an opportunity for us to co-develop or co-create a solution with an industry partner that really gets to the matter at hand. Because at the end of the day, some of the solutions that are out there may not be perfectly applicable to problems that every institution is trying to solve. And so how to adapt that and how to co-create new solutions, I think is very helpful. It's the old adage, you can't always fit a square peg in a round hole. And so that's why these partnerships between industry and academia are going to be important, because I think solving the problem is going to result from defining the problem that needs to be solved most effectively.
Great. And I have one more question here. This is regarding the landscape of ergonomics, and how that's currently undergoing change and adaptation. Do you think our training methods evolving at a pace is really matching this development? And how is the evolution feeding back into the simulation processes?
Yeah, so this is certainly an iterative process, and as we look at companies coming out now with new technologies and new hardware, we really are seeing an effort around ergonomics and user interface. So, one of the big things that was talked about a lot when Apple came into this environment more recently was that one of the functionalities of the AR that they're bringing forward is that it seamlessly integrates with all other Apple products from a user interface perspective. And this is to address some of the challenges that others have voiced around some of the UI UX of some of these of headsets. I still think there's a lot of work that needs to be done. There's still a lot of form factor issues, and part of that is that when you try to include all of the processing power and other things into these headsets, it changes the bulk and amount of materials that have to go into the design. And some companies have thought about, can you pull all that out of the headset into a separate computer processor so that the headset can be much more form factored and appropriate for easier use. So I think those are things that are evolving, and certainly incorporating clinicians into that user experience is going to be key, because at the end of the day, the end user is really going to drive the adoption of what the ergonomics need to go.
Great. And then just final question. If we are able to get a copy of the PowerPoint from Dr. Cohen.
Yeah, this is a recorded session, so the access to all the slides should be available through that.
Great. And then I think I'll pass it on to Stephen. Thank you so much, Dr. Cohen, for your time.
Oh, thank you so much, Jonathan. We appreciated it.
Everyone stand by for a moment. I want to tell you about the next talk on the schedule before I wrap things up. It's a talk that I'm pretty excited about. It's I've been saying that the most important innovative thing that we can do is to think outside of the headset, because if the headsets and immersive technology, hardware and software that we're going to be using in 5 years from now isn't going to look anything like what we're using now. So starting to think outside the headset is important. I came across this paper from Dr. Shimolovich about building a low-cost AR goggles to enable precision fluorescent guided cancer surgery. It's a application-specific headset and very worth taking a look at in terms of what are the next stages of development for medical XR. So with that, I'd like to thank everybody for joining us. This was a wonderful talk and impressive in the breadth of expertise from AI evaluating movements to training. So I'd like to thank Dean Cohen for the time and attending and presenting to us. I'd also like to thank Ryan Monahan on his staff, who was very, very helpful in reaching out to everybody. And I'd like to say thank Jonathan for being the excellent moderator that he was. Domain experience is everything in this world. It's going to determine what the user interface standards are, and it also defines the conversation that we had today. So I want to thank you, Jonathan, for joining us, and we'll see you in a couple of weeks. Take care.